Welcome back to my History of Renal Medicine lecture series, in which we explore the colorful history of our understanding of one of the most important organs in the human body. In our last lecture, we explored the advances in diagnostic techniques that helped prime the foundations for the modern era of renal medicine, including the inception of immunofluorescence microscopy, the periodic acid shift stain, and, most importantly, advances in the technique of obtaining the kidney biopsy itself, leading to an innocuously titled paper co-written by Conrad Pirani in 1955, Biopsy of the Kidney in the Diagnosis and Management of Renal Disease. I'm Matthew Tortora, and I practice diagnostic pathology in northern New Jersey, serving Cooperman Barnabas Medical Center and Clara Moss Medical Center. This is the 7th installment in a multi-part lecture series on the history of renal medicine, which I've given to the departments of pathology, medicine, and humanities at Cooperman Barnabas Medical Center. This is part 3 of the third lecture, entitled Needles, Nodules, Aldehydes, and Electrons, Before and After Conrad Pirani. Let's get started. With the ability to safely and easily access the kidney for diagnosis, there was an explosion of clinical research in the ensuing decade, where it once would have been enviable to have even samples from 10 patients. Studies were now being published with the findings from hundreds and sometimes thousands of subjects. In the midst of this explosion, or more accurately as a result of it, an article was published presenting a new histologic stain developed to better visualize the finer structures of the glomerulus, with even finer contrast than the periodic acid shift stain. It was called the silver methanamine stain, or silver stain for short. It was first utilized to stain the tissue from kidneys of patients with high levels of protein in their urine who also suffered from a disease called membranous glomerulonephritis. It was called membranous because the glomerular walls, or membranes, had a thickened pink glassy appearance on hematoxylin-stained tissue. But when you stained these glomeruli with silver stain, innumerable spike-like projections appeared. Here is a silver-stained glomerulus of a healthy patient. The silver stain is in black, and the pink is a counterstain. And here is a silver-stained glomerulus of a patient with membranous glomerulonephritis. At this low power, the membranes take on a fuzzy appearance. Here is a high-power image of the silver-stained glomerulus from the original article, showing numerous spike-like or club-like projections along the basement membranes. And here is that image side by side with an image taken in my own lab. The silver stain is still used to this day as part of the traditional battery of stains performed on the kidney biopsy. In the years ahead, the cause of the spikes in membranous glomerulonephritis will be revealed as an injury pattern to the capillary walls, a remodeling of the basement membrane material as the result of noxious deposits of immunologic compounds along its outer surface. And so by the mid-1950s, we now have 3 stains in our light microscopic kidney battery: H&E, PAS, and silver. In 1957, A.R. Rich's work put forth in the Bulletin of the Johns Hopkins Hospital entitled A Hitherto Undescribed Vulnerability of the Juxtamedullary Glomeruli in Lipoid Nephrosis. He would exploit the improvements in renal biopsy to discover that some treatment-resistant patients with clinical features of lipoid nephrosis, that is, with presumed minimal change disease, had instead focal segmental glomerulosclerosis when looked at on microscopy, and thus an important split in classification was created. For reference, on the left is a segmentally sclerotic glomerulus, and on the right is a normal glomerulus, as might be seen in true minimal change disease. By the time we reach the 1960s, 2 very important French physicians will enter our story. The first is Jean Amberger. He was a professor of medicine at the University of Paris. He's considered a founder of modern nephrology. He's even credited with coining the term nephrology. He was also a founder of the International Society of Nephrologists and a pioneer in the development of, quote, the artificial kidney, something that would have predecessed the modern-day technique of hemodialysis. In 1962, he directed the first successful non-identical twin human kidney transplant, and he was even a member of the French Academy of Science. For those unfamiliar, the French Academy of Science was founded in the 17th century by Louis XIV to encourage research. It still exists today, but in a drastically different concept. That man's student was this man, a nephrologist whose name will be revealed shortly to maximize dramatic effect. He was trained in Paris as well, and in 1960 he published Contribution of the Renal Biopsy to the Pathologic Knowledge of the Kidney Diseases. In 1962, he provided the first description of something called dense deposit disease, a rare autoimmune disease that damages the glomerular basement membranes, leaving ribbon-like deposits identifiable by electron microscopy, based on a 2-series renal biopsy set. We'll talk a little bit more on that later. In 1967, though, he would discover the disease that would informally bear his name. In 25 biopsy patients, he observed an immune-mediated disease in the setting of segmental glomerular sclerosis on light microscopy, and bright staining for an antibody called IgA, immunoglobulin A, which outshone all the other immunoreactions in these patients. The disease would be called IgA nephropathy, also called Berger's disease. Here is what the glomerulus looks like. On immunofluorescence staining directed with IgA. One can appreciate the bright immunofluorescence staining within the mesangium of this glomerulus. With the appropriate numbers of biopsy specimens now flooding into labs across the country, the second half of the 20th century saw the onset of the electron microscope as an adjunct in the evaluation of kidney biopsy. Indeed, it was in 1957 when Farquhar published Glomerular Changes Observed with the Electron Microscopy. And for the first time, one could see the structures of the glomerulus magnified thousands of times. Here is an image of a glomerulus afflicted by minimal change disease, in which we can see that the foot processes lining the outer basement membrane have lost some of their discretion. In other words, a disease with protein in the urine that looked, quote, microscopically normal to earlier pathologists such as Gabriel Valentin, pictured here, finally has a morphologic explanation. The foot processes are damaged on electron microscopic evaluation. This is the Annenberg Tower at Mount Sinai Medical Center in New York. Its Department of Pathology features some of the most scenic views in all of Manhattan. It was at this hospital that a great deal of the pioneering work in the field of electron microscopy in the kidney would be performed by a man named Jacob Churg. Those in medicine will recognize his name and that of his colleague Lottie Strauss in the vascular immune-mediated disease process they first described, called Churg-Strauss syndrome, originally called allergic granulomatosis, allergic angiitis, and periarteritis nodosa. And today it is called eosinophilic granulomatosis with polyangiitis. Personally, I like its informer eponymous name, Churg-Strauss syndrome, better. Here we can see a bird's eye electron microscopic image of a whole glomerulus through the geometric holes of its copper mesh. It was Churg's work with the electron microscope that helped advance its use in the routine workup of kidney biopsies. It gave us a better understanding of the immune deposits seen in diseases such as membranous glomerulonephritis, pictured here, IgA nephropathy, pictured here, and even the ribbon-like deposits seen in dense deposit disease, pictured here, among many others. In the early 1960s, Dr. Pirani's review of the second edition of Allen's The Kidney appeared in the Journal of the American Medical Association. In it, he says, quote, The new edition is a valiant attempt to bring up to date our present knowledge in the light of so many of the major advances in recent years, end quote. Notable to him are new chapters on nephrotic syndrome, membranous glomerulonephritis, and renovascular hypertension. He even mentions the contributions of electron microscopic images by Dr. Farquhar. However, Pirani ends the review with the major shortcoming of the book. That is, its failure to integrate the new information obtained by percutaneous renal biopsy. So it seems that Dr. Allen was still a bit behind the times, but all of that was about to change. Because here in Baltimore, in 1966, an associate professor in pathology at Johns Hopkins University Medical Center named Robert Heptonstall would publish a seminal textbook. As a graduate student, he had trained under Alexander Fleming, the discoverer of penicillin at St. Mary's Hospital, a place you might remember being mentioned in a previous lecture. The book he published was called Pathology of the Kidney. It included 836 pages. 161 of them were dedicated to glomerular diseases, an impressive feat. And an even as significant milestone, it includes 45 pages on the newly emerging field of transplant pathology. Perhaps most importantly, Heptonstall integrates the findings of numerous studies based on percutaneous renal biopsy. And yet, even with this influx of new information, he still admits in his preface that glomerular disease still remains a poorly understood condition. Nonetheless, by the 1960s, as we have seen from this lecture and all the preceding ones, we now have gathered a scientific understanding of post-streptococcal glomerulonephritis, amyloidosis, hypertensive arterionephrosclerosis, thrombotic microangiopathy, Alport syndrome, diabetic glomerular disease, membranous glomerulonephritis, IgA nephropathy, minimal change disease, focal segmental glomerulosclerosis, all helping to whittle the all-encompassing eponymous term Bright's disease down to a smaller and smaller size. At the turn of the 21st century, the giants at the inception of the modern era of nephrology were slipping away to the ages. The very last to pass on was the venerable Dr. Heptonstall in 2021, at the age of 100 years old. His textbook on the pathology of the kidney, now in its 8th edition, remains the seminal textual reference for the pathology of the kidney. Although the pioneers are gone, their legacy lives on in their teachings and publications and the groundwork that they laid in setting the stage for modern renal medicine. Many of their students and their students' students have disseminated to some of the best and most prestigious centers in the country to continue to advance the field of renal pathology. This will conclude my presentation series. I hope by now to have thoroughly demonstrated the short-sightedness of H.A. Christian's quote from 1922. It is not possible to diagnose in life the anatomic changes that will be found in the kidney after death. I hope you have thoroughly enjoyed journeying through the lives of the many giants whose shoulders we stand upon. And perhaps, as Rachel Carlson so eloquently believed, in sharing this journey, I have aroused a sense of the beautiful, the excitement of the new and the unknown, a feeling of sympathy, pity, admiration, or love, so that you wish for more knowledge about the subject of that emotional response. It has been my honor to share this presentation series with you. If you enjoyed this presentation, want to see more like it, or have questions about the history of medicine or of pathology, feel free to contact me. Thank you so much.